NHA Medical Assistant Exam Prep. Question 1. A patient is scheduled for a guaiac fecal occult blood test, FOBT. Which of the following dietary restrictions should the medical assistant instruct the patient to follow for 3 days prior to the test? Option A. Avoid consuming red meat. Option B. Avoid drinking water. Option C. Consume high amounts of dairy products. Option D. Avoid eating fiber-rich foods. The correct answer is option A. Avoid consuming red meat. Red meat should be avoided before a guaiac fecal occult blood test because it can cause false positive results. Water and fiber are generally not restricted unless the provider gives different instructions. Question 2. A patient presents with a laceration on the forearm. The medical assistant notes that the bleeding is bright red and spurts in sync with the patient's heartbeat. Which of the following types of bleeding is occurring? Option A. Capillary. Option B. Venous. Option C. Arterial. Option D. Internal. The correct answer is option C. Arterial. Bright red blood that spurts with the heartbeat indicates arterial bleeding due to pressure from the arterial system. Venous bleeding is usually darker and flows steadily. Question 3. A medical assistant is calculating a pediatric dose based on a provider's order. The order states, give 15 mg/kg. The child weighs 20 kilograms. How many milligrams should the assistant administer? Option A. 150 milligrams. Option B. 200 milligrams. Option C. 300 milligrams. Option D. 350 milligrams. The correct answer is option C. 300 milligrams. The ordered dose is 15 milligrams per kg multiplied by 20 kilograms, which equals 300 milligrams. The assistant should verify calculations and follow medication safety procedures before administration. Question 4. Which of the following terms refers to the absolute legal right of a patient to make autonomous decisions regarding their own healthcare and medical treatment? Option A. Beneficence. Option B. Non-maleficence. Option C. Justice. Option D. Autonomy. The correct answer is option D. Autonomy. Autonomy is the patient's right to make informed decisions about personal health care. Beneficence means acting in the patient's best interest, but it does not define decision-making authority. Question 5. A medical assistant needs to perform a routine urine drug screen for an employment physical exam. Which of the following protocols must be strictly followed to ensure the integrity of the sample? Option A. Random urine collection protocol. Option B. Chain of custody protocol. Option C. First morning void protocol. Option D. Clean catch midstream protocol. The correct answer is option B. Chain of custody protocol. Chain of custody procedures document specimen handling from collection to testing and are essential for legal or employment drug screens. A routine clean catch protocol does not provide the same legal integrity. Question 6. Which of the following instruments is used to examine the interior structures of the eye, including the retina and optic nerve? Option A. Otoscope. Option B. Ophthalmoscope. Option C. Tonometer. Option D. Speculum. The correct answer is option B. Ophthalmoscope. An ophthalmoscope is used to inspect internal eye structures such as the retina, optic disc, and blood vessels. An otoscope is used to examine the ear canal and tympanic membrane. Question 7. A medical assistant is collecting a clean catch midstream urine specimen from a female patient. Which of the following instructions is crucial for obtaining an uncontaminated sample? Option A. Cleanse the perineal area from back to front before voiding. Option B. Collect the very first stream of urine that exits the urethra. Option C. Cleanse the labia from front to back using separate antiseptic wipes for each swipe. Option D. Keep the specimen container open on the counter for at least an hour before capping. The correct answer is option C. Cleanse the labia from front to back using separate antiseptic wipes for each swipe. For a female clean catch specimen, the labia should be cleansed front to back with separate wipes to reduce contamination. Collecting the first stream increases contamination from urethral flora. Question 8. Which of the following terms refers to the movement of a limb or body part away from the midline of the body? Option A, adduction. Option B, flexion. Option C, abduction. Option D, extension. The correct answer is option C. Abduction. Abduction means movement away from the body's midline. Adduction means movement toward the midline. Question 9. Which of the following parts of a needle refers to the slanted tip that allows for smooth penetration into skin or veins? Option A, shaft. Option B, hub. Option C, bevel. Option D, lumen. The correct answer is option C. Bevel. The bevel is the slanted tip of the needle that assists smooth penetration. The lumen is the hollow opening inside the needle shaft. Question 10. A medical assistant is measuring a patient's apical pulse. Which of the following areas should the assistant place the stethoscope? Option A. At the 5th intercostal space, left midclavicular line. Option B. At the 2nd intercostal space, right sternal border. Option C. Over the carotid artery in the neck. Option D. In the antecubital fossa of the left arm. The correct answer is option A. At the 5th intercostal space, left midclavicular line. The apical pulse is auscultated at the 5th intercostal space at the left midclavicular line. The second right intercostal space is an aortic valve auscultation area, not the apical pulse point. Question 11. Which of the following specific layers of the skin contains blood vessels, nerves, hair follicles, and sweat glands? Option A, epidermis. Option B, dermis. Option C, subcutaneous layer. Option D, stratum corneum. The correct answer is option B. Dermis. The dermis contains blood vessels, nerves, hair follicles, sweat glands, and connective tissue. The epidermis is the outer avascular layer of skin. Question 12. Which of the following diagnostic codes is used to classify signs, symptoms, injuries, and diseases within a medical billing system? Option A, CPT. Option B, ICD-10-CM. Option C, HCPCS Level 2. Option D, MSDRG. The correct answer is option B. ICD-10-CM. ICD-10-CM codes classify diagnoses, signs, symptoms, injuries, and diseases. CPT codes describe procedures and services rather than diagnoses. Question 13. Which of the following steps is the correct sequence for applying personal protective equipment, PPE, when multiple items are required? Option A, gloves, gown, mask. Option B, gown, mask, gloves. Option C, mask, gloves, gown. Option D, gloves, mask, gown. The correct answer is option B. Gown, mask, gloves. The correct sequence for applying multiple PPE items is gown first, then mask or respirator, then gloves. Gloves are placed last so they cover the gown cuffs. Question 14. A medical assistant is instructed to administer an intramuscular injection to an infant who is 9 months old. Which of the following muscles should the assistant use? Option A, deltoid. Option B, vastus lateralis. Option C, gluteus medius. Option D, dorsogluteal. The correct answer is option B. Vastus lateralis. The vastus lateralis is the preferred intramuscular site for infants because it is well developed and away from major nerves. The deltoid is usually too small for reliable infant IM injections. Question 15. Which of the following forms is used by a medical provider to submit an insurance claim for services rendered in an outpatient clinic setting? Option A UB04. Option B CMS 1500. Option C W2. Option D to 2501. The correct answer is option B. CMS 1500. The CMS 1500 form is used to submit outpatient professional claims. UB04 forms are used primarily for institutional or facility billing. Question 16. A patient requires a legal document that specifies what medical treatments they want or do not want if they become terminally ill or permanently unconscious. What is this document called? Option A Informed Consent Form. Option B Durable Power of Attorney for Finance. Option C Living Will. Option D Encounter Form. The correct answer is option C. Living Will. A living will states which treatments a patient wants or refuses if they become terminally ill or permanently unconscious. A financial power of attorney does not direct medical treatment choices. Question 17. A medical assistant is reviewing a patient's chart and notices the term splenomegaly. The assistant should understand that this term means which of the following? Option A Enlargement of the spleen. Option B Inflammation of the stomach. Option C Surgical removal of the gallbladder. Option D Softening of the liver. The correct answer is option A. Enlargement of the spleen. Splenomegaly means enlargement of the spleen. The suffix megaly means enlargement, while spleen/o refers to the spleen. Question 18. A medical assistant is performing a rapid strep test on a patient. From which of the following areas should the assistant collect the specimen swab? Option A. The roof of the mouth and the tongue. Option B. The buccal mucosa of the cheeks. Option C. The tonsillar pillars and posterior pharynx. Option D. The anterior nares of both nostrils. The correct answer is option C. The tonsillar pillars and posterior pharynx. A rapid strep swab should be collected from the tonsillar pillars and posterior pharynx while avoiding the tongue and cheeks. Swabbing the oral mucosa can produce an inadequate specimen. Question 19. A medical assistant needs to calculate a patient's body mass index, BMI. Which of the following pairs of measurements are required for this calculation? Option A Waist circumference and hip circumference. Option B Height and weight. Option C Age and weight. Option D Chest circumference and height. The correct answer is option B. Height and weight. BMI is calculated from height and weight. Waist and hip circumference are used for body fat distribution measures, not BMI. Question 20. Which of the following acts protects individuals from discrimination based on health insurance status or pre-existing conditions and establishes strict rules for the privacy of protected health information? FI. Option A ACA. Option B HITECH. Option C HIPAA. Option D OSHA. The correct answer is option C. HIPAA. HIPAA establishes privacy and security rules for protected health information and addresses portability of health coverage. OSHA focuses on workplace safety rather than privacy.